Meanwhile, there is a mental health worker shortage, and officials say it is causing a crisis among kids and teenagers who need those services.
Yes, Joy Addison joins us with more on what is being done to help the nation's youth. Joy.
Anthony and Tia, good evening. There's a lot that's being done, and that's because this shortage is dire. The Department of Health and Human Services says if this mental health worker shortage continues, we will have 10,000 less workers in this field than we need by the year 2025.
Texas is dying for extra help to the family.
Gail Fisher is a mother of two navigating mental health resources in her area.
Even in the county in which we live, not enough resources. I have mom friends who we get together and we just debrief ourselves and we share resources.
Fisher and her friends are among tens of thousands of Texans struggling to find help.
Texas, according to Mental Health America, ranks last when it comes to access to children's mental health services.
Texas is not alone. There is a nationwide shortage of mental health professionals, but it's worse for children and teenagers. The American Academy of Children and Adolescent Psychiatry says nearly 1 in 5 children experience a mental health issue, but of those, only about 20% receive care. Across the nation, every state either faces a high or severe shortage of mental health workers.
Some families will have to travel 1 or 2 hours just to meet in person with a mental health professional, which means there are other barriers and challenges that they have to overcome, such as childcare, taking off work. It could be transportation.
Dr. Melissa Whitson studies behavioral health. She says this shortage was made worse by the pandemic when mental health workers experienced burnout as their caseloads increased. She says if this shortage continues, it may put families at risk.
It increases the risk that we get mental health issues, challenges, behavioral challenges, substance use, juvenile justice involvement, all these negative outcomes that we want to, avoid and prevent.
And last Friday, the U.S. Department of Health and Human Services announced about $25 million will go to expand health care, including mental health services in schools. For the first time ever, in order to apply for funding, schools will have to show proof of expanding mental health services. In Houston, Joy Addison, Fox 32, Chicago.